So my name is John Ikonomidis. I'm a cardiothoracic surgeon. I'm the chief of the Division of Cardiothoracic Surgery at UNC. I've always told people that I was going to be a doctor and I was going to be a surgeon, and I sort of never wavered from that. The thing that I love about cardiac surgery is that I've always said it, and it's a fact, is that what happens in the operating room has a direct effect on how the patient does. And if the heart is fixed, the pump, which the heart is, if you fix the pump, the patient usually gets better. Not always, but the vast majority of the time, which is very gratifying. The heart was this dynamic structure that, it beats and it keeps the circulation alive. And what's incredible is that our evolution of applied physiology has allowed us to invent this bypass machine, which does the work of the heart and lungs, which enables us to hook the patient onto the machine, stop the heart for a period of time, do complex operations, and start the heart back up again, all under support of this machine. And then we can let the heart take control of the circulation, hopefully repair it. I bring to the table about 20 years of experience, and I've done a lot of cardiac surgery of different types during that period. I do clinical cardiac surgery like coronary bypass operations, valve operations. I do a lot of thoracic aortic surgery. I've also been very heavily involved in transplant and heart failure, so I've done a lot of heart transplants, a lot of heart failure operations. So if you come specifically to see me, it's likely that the condition you have I've seen before and I've treated before, and it's not foreign to me. But even more important than that is that when you come to UNC, you're coming to a tremendous institution that is populated with individuals that have tremendous experience. They're tremendously collaborative, and they all work together to give the patient the best experience they can possibly have. Everybody brings different levels of expertise to the table. And so having a group of physicians all working together with the common goal of improving patient care just makes sense. And it creates a situation where every possibility, every nuance of care is thought of, and every complication and every issue is picked up early and dealt with properly and promptly. And so at the end of the day, that translates into the best results. UNC, it's the sixth highest funded, NIH-funded university in the country, and it's the #1 public university in the country. And the resource structure here is incredible. The culture of clinical care here is extremely collaborative and very collegial and very refreshing, honestly. And so I've just found it to be a terrific place to work. I felt that my career professionally and from a research perspective and also from a clinical perspective has just thrived here with the terrific people that are here. The biggest thing that we may bring to the table from our lab work is to come up with a method of predicting the presence of aneurysms just from a blood test. An aneurysm is what happens when an artery expands and gets larger than it should. And if it expands to greater than 50% of its normal size, that's considered an aneurysm. And after it exceeds 50%, it poses a problem because the wall of the artery becomes weak and it may burst, or it may dissect, which is another very terrible condition. It would be good to know in advance which patients have these, and in patients that do have them, it would be good to know things like how aggressive is the aneurysm growing, how high is their risk of rupture. And with the studies that we have done, we are working out techniques to be able to answer all those questions just from a blood sample. The cardiothoracic surgical division is divided into 3 sections. There's the cardiac surgical section, the thoracic surgical section, and then the pediatric cardiac section. They're all incredibly well trained, very, very skilled surgeons. And I can honestly say that I would have any one of them operate on a family member of mine. I trust them, and I've seen their results firsthand, and they're all outstanding. And they're great people too.